started the broadcast. Thank you. Morning, everybody. Councillor Mike Quigley, and Chair of the committee, the Adult Social Care and Public Health Select Committee, which is meeting today, the 13th of March. And it is being broadcast live and recorded for publication. Agenda item 1 then. Could I ask for approval of the minutes of the last meeting? Everyone content? Show of hands, yeah. Thank you very much. Apologies for absence. Do we have any apologies?
Sorry, we have apologies from Councillor Sybil Fielding and Councillor Lynn Guilfoyle is substituting for her. And we also have apologies from Councillor John Doddy.
Thank you very much. Declarations of interest. Does any member or officer present have any disclosable pecuniary interest to declare? No. Do any members or officers have any private interest, pecuniary or non-pecuniary, to declare? No. Agenda item 4 then is the Nottinghamshire Day Opportunity Strategy Implementation 22 to 27. And I'd like to invite Councillor Barney to introduce the report, and he's obviously being supported by Mel, Bridget and James. So over to you.
Good morning, Chairman, and yes, hand immediately over to Competence and Mel will introduce this item. Thank you.
Good morning, committee members. So this is a session to have a look at how well we're doing in implementing the Day Opportunities Strategy. So just as a bit of a reminder, this was agreed in the previous council scheme of governance, so under the Adult Social Care and Public Health Committee in April last year. It was a piece of work that we had been working on for previous 2 to 2.5 years, involving co-production of people that use the services, co-production people that potentially were using them. Members of Adult Social Care Public Health Committee have been very involved in that process, and it had been to committee a number of times on its genesis through. It was finally agreed in April. So really here what we're wanting to focus on is how well we're doing at delivering the objectives in the strategy, and to really just hear about you as your some thoughts, some challenges, and how we might consider in the next round of the implementation any changes we might make. So I'm going to ask James Wheat to present, if that's okay, and then myself or Bridget or James can answer any questions that you may have once we've talked you through the presentation.
Thank you, Melanie. Good morning, everybody. Hopefully you can see the slides which should be on the screen. So we produced a 5-year day opportunity strategy to really understand, importantly, what people wanted from day opportunity provision, and to try and reimagine the thinking between beyond perhaps just day service building-based provision to the breadth of things people may wish to be supported within the community. What we recognised is there were clear themes which came out of that piece of work, really trying to connect people to their local communities, and we recognised that there was quite a breadth of evidence, particularly around learning disability and autism, about the disconnect at times between the lives they lead in their communities and the access they have to a range of things which perhaps other people in the community may be afforded. We recognised how important it is to personalise the approaches, and there was also very clear evidence that at times there is specialist support required, and again autism and dementia were areas where we really saw that as a prevalent theme. In Nottinghamshire we also have an opportunity to develop and cultivate our ability to support people with disabilities into meaningful employment, developing the skills and opportunities to do that. And what we recognise is their opportunities themselves have a unique opportunity and place to work with people, support people, to help them meet their aspirations. And if that is employment based, then there is an opportunity for us to, through contracting and the way we deliver services, to support people who access those types of provision. Excuse me, stop moving through. We created this model which is depicted in an inverted triangle to essentially look at the tiered ways people may wish to access services. So we recognise at the top tier the early intervention and prevention. People who access their opportunity may sometimes require time limited support or navigation to support particular opportunities or particular places in the community, and they potentially wouldn't require a service indefinitely. That there are individuals who could perhaps be supported into things which are not indefinite services, of course. We looked at the opportunity for reablement and enablement and felt very strongly again that day opportunity provision has a really strong place in supporting people to understand what are their aspirations, what is their potential, and how we can work to develop skills, develop confidence, meet friends, and all the range of things which sits within enablement to support people to potentially have quite time limited interventions with really good outcomes and clarity. As it goes through the triangle, you see at the bottom, again, there is clear need for specialist and intensive support, and whether that's through a range of things currently delivered or potentially, as the report sets out, new ways of working which may involve our health partners and a range of other partners, how we can support people who have significant and profound or high acuity support needs to ensure that they get the support they require. And one of the lenses which was very clear, there is a significant proportion of our population who use day opportunity provision who still live with family carers or receive support to maintain independence at home, and we recognise the day opportunity pathway, which includes day services and a range of things, is a very important support component within that. It's something we wanted to reflect within the strategy. As you can see on the document, we have a significant number of people who use day opportunity, so it's around 1,400 people per week who are commissioned to either access an internal or an external day opportunity provision. It is across a wide range of support needs as listed on the document. We do know the predominant use of day services or day opportunity is for people or adults with learning disabilities, just for reference. It's about 70%. The budget is 18.4 million, and that's split as the report details between internal and external provision. And as part of the day opportunity strategy creation, there was a wide range of engagement and co-production and consultation exercises which ranged for about 1,500 people, so it's quite extensive as it needed to be. Excuse me, it's not moving very quickly. The report sets out our progress against the strategy. So from an external perspective, just wanted to reflect, we have entered into a new tendering exercise for external providers, and this is very important for the council's ability to influence the delivery mechanisms from our external partners and providers. So we have updated a service specification which sets out the vision and the types of activities we would expect to be delivered under day opportunities. And importantly, once the framework's in place, it enables us to contract differently with our partners and providers. And so where we want to influence and change the delivery models, we have a contract arrangement which gives the authority much more ability to facilitate the changes we'd expect and defined in the strategy. The report sets out, and it's highlighted here, just some of the particular activities which have supported the delivery. So very quickly, we have revised monitoring and evaluation. So we recognise there is significant financial investment. We recognise that there are a great number of people who attend day opportunity provision, and we want to ensure that we properly can evaluate and monitor the impact these services and these opportunities have for people. So what are the outcomes people receive? How do we know? How can we measure? How do we know if good is happening and what good looks like? So we spent a lot of time working through a revised monitoring and key performance indicator process with our individuals who use services and importantly the providers who deliver them, including our internal services, to really cultivate a new way of understanding. And what we hope very strongly is going forward in future reporting, we will have a much stronger foundation to describe what is happening in terms of outcomes, how people are being supported to achieve within our day opportunity provision, and reflect what that means in terms of our levels of investment in services. We also have various ongoing conversations as a department. So employment being one, we recognise again it's not just the county council who can influence employment. So we have a range of stakeholders who we're working with to ensure that there are meaningful opportunities for people to develop skills and, very importantly, opportunities to access employment and volunteering opportunities. And similarly, we are currently in discussion with the Integrated Care Board to the ICBs and the Trust around specialists, so very complex support around learning disability, autism and dementia, and how we potentially want to consider what that looks like in Nottingham and Nottinghamshire within our ICS. Within our internal services, there is a development plan which will begin with consultation activity from April onwards. So there'll be a very important consultation and co-production element to really understand from an internal perspective where we deliver services, what people want, how our staff feel changes could be made, and really importantly, this could reflect in ensuring that the offer is fit for purpose in terms of our new day opportunity strategy. The offer, thinking back to that triangle, we really want to ensure that any meaningful changes we make are aligned to the model. And so, as you can see here, there are already some themes which are being developed within the work to try and ascertain where we can best support people and work with the range of opportunities and partners, providers, voluntary sector organisations within day opportunities, and really expand the thinking from not just a day service building based, but a day opportunity pathway where there's lots of facets and ranges of support which people could access, and importantly personalised in what's right for them and when it's right for them. I'll leave this up for Michael. Please do not come in with any questions you may have. Thank you.
Thank you. Reg, you indicated you wanted to ask a question.
Sorry. Special intended, thanks. I've got my look after me. 23. Special dimension episode report will be developed. Have we got this developed already? Haven't we got this to look after? Because we've got quite an aging population who have Alzheimer's, dementia, whichever way you want to phrase it. I'm not a medical person. And then in young people, we've got an awful lot of autism and other associated things. And to say we haven't got a support in being developed to look after these and help these people, especially the young autism ones, because as you were saying, creating jobs, getting them into work is very important to them and getting a balance of life for them. How come we're so far behind or we're weak in that area and we haven't got a plan yet?
Thank you, Councillor Adair. I think it is important to reflect we have a very robust and diverse range of day opportunities currently. So we have 10 services which are delivered directly by the County Council. There are around 60 individual external services which cater for a range of support needs. We continue, certainly as a commissioning team, to understand what the emerging evidence and trends would tell us. And one of the things we have certainly identified linked to the national evidence is the emergence of adults with learning disability and the early onset of dementia. And so it's those types of queries where we just want to understand, do the services have the right range of staff in the right environments to support people who potentially have complex support needs which may change over time. And there's certainly some evidence locally that maybe we don't always get the right suite of opportunities for individuals with very specialised and intense support needs, which are usually predicated under individuals needing direct one-to-one support whilst they're in attendance at a service. Part of this work is to consider not just the County Council as a partner, but how we work with the Integrated Care Board, the Trust, to ensure that the resources and the suite of things we have available as a system are used in the best way to support the emerging evidence and needs. So apologies if that reads that there is nothing and we've got to develop from it. It's much more considered than that, in that we do have lots of opportunities for people, but it's whether or not we want to consider how they could be reiterated or changed going forwards.
I think just to add, Councillor Adair, so we've got two, I suppose they're emerging needs. So we do have a whole range of support structures in place, but there's certainly a big group of people, particularly accessing our internal day services, who have had Down syndrome or learning disability since they were born, and 10 years ago would not have survived to the age they're at. That group are much more at risk of dementia and early onset dementia because of they present as very frail and elderly. So we've realised that we've got to try and change the way that we support those people within our services. At the moment, they access the services as any other person would. So there's a bit of that personalised approach that we think we're missing. So that's a bit about the dementia services. We also know from carers through the carer work that there's a bit of a gap. So people supporting a loved one with dementia do feel they need more support And as James has said, that's something we're not solely responsible for. So it's something we need to do jointly with the integrated care system. And that is because, again, because the growing number of people experiencing dementia. So we do have some, but we just know that it's not really what people want or need or good enough. So that's why it's developing. Yeah, no, thank you for the nudge of autism, and it does remind me of that story that we dealt with together about 2 years ago. So what we also know is that there is a growing group of younger adults who have been successful at school, so sort of have been through support through the education system, through the SEND system, have coped very well, gone to university, and then as soon as they get to independence have struggled. So they're not able to live independently at the age that another person, another young adult, would because of the needs with the autism, but they haven't needed social care before, then have gone into a crisis. And that's that group I think James described, that people needing a bit of support, the enablement, because an adult like that's capable of work, capable of university, but they do need that extra bit to get them back into independence, to find some independent accommodation from a family home, and to get some of those work skills. So that's where we're really wanting to shape our enablement and employment offer.
Kristen, I just find with the autism that it's more in one parent families that I find it or come across it. So I don't know whether there's a lead there or anything that may at some point help.
And our carer strategy, which I think James indicates in the paper, is linked, but that's where that also comes into play, because I think for any parent supporting an adult with autism will often find that they are the sole source of support, and that can be quite draining. So it's kind of not as sitting alongside a day opportunities, but it's a really important bit of adult social care to enable the carer as well to cope with that situation, because they do have an unfair burden, as you've recognised.
Thank you. Councillor Pringle.
Thanks, Chairman. James, thanks for the report. And I wasn't going to speak actually, but you pointed out starting points during your report. And I've just, on page 23 and 24 of the Nottinghamshire Day opportunities, and this is just for clarification, how do we measure the implementations and what is our starting point? And if we have a starting point, will we then be able to see the results at a later date of the implementations, assuming that they're going to be better? Because at the minute, I'm not understanding that.
Yeah, thank you for the question. We have some measures, so we would term them benchmarking. So we know, for example, the individuals who currently access the opportunities, we know how many of those live at home, how many can be supported with a family carer, and what type of other support they receive. We know how many people and potentially the likelihood of someone who accesses a day opportunity who then potentially may go into crisis and may require much more intensive forms of support, or even hospital admission or sectioning. So we have, I think, a richness of benchmarking data, but it is quite complicated in a day opportunity sense, and it would be remiss to pretend otherwise, because often people who attend a day opportunity or a day service don't just receive that form of support. There's a breadth of things people access in their lives, things important to them. So what we've intended to cultivate within the new specifications and a service level agreement with our internal services is some much more revised and considered monitoring and evaluation, so we can start to really unpick on an individual level what are the outcomes people are hoping to achieve when they access a day service. And that is something I think at the moment there's lots of activity and some really positive activity, but to ascertain on an individual level, is that person gone to a day service to do something or to achieve something, and has that been achieved? We felt it was quite difficult to pull that out in the current way we do it. So I think we can, on a population level, benchmark, and we can also have some real richness around, are people achieving the outcomes they want to? And I think in the spirit of strength-based and putting people at the heart of the care and support they receive, that's really important to us to understand. Is it working? And how do we know it's because people will reflect that they're getting what they want out of a day opportunity? And that will give our opportunity from a social care and social workforce to really try and ascertain, well, if we're placing or supporting someone to go to a service or an opportunity, what is it we expect to see in 6 months, 12 months? And so there'll be some quite time limited or sometimes time defined ways we can work out, is this working? And again, from a commissioning perspective, that information is really useful because it may identify gaps in workforce and training and the types of environments which may be needed to support people in slightly different ways. And so from our perspective, we would really want to ascertain and monitor this data which is coming through. Is not just about data driven, but it's one lens we can start to really understand how we may wish to support and make changes. And certainly that information, I think, would be very pertinent to be reflected back into this forum in future dates, when I think we are better positioned to understand what it's telling us, because at the moment the specifications and contracts aren't in place. It'll be from the summer onwards this year. Thank you.
Just to come back, so you've set benchmarks which are clear for us to work to, and you'll be able to respond back to us in a period of time with a degree of success or not accordingly on them benchmarks. Thank you, Chairman.
Thank you. I'd just like to develop that, because I'd actually scribbled some notes against that. Whilst the outcomes and quality of life measures are all well and good and written down in the strategy, what we need to be looking at in future is where our starting point is and where we are. The strategy has been in being since 22, so it's been running for at least a year already. I would suggest that we would want to revisit this and look at benchmarking, have a report, even if it's only just a written report sent around to members of the committee, as to what metrics we're using to measure our performance and where we stand, where we started in 22, where we are now, and then revisit in 6 months' time. Is that acceptable, Mike? Do you think that'd be useful?
Yeah, very much so, Chairman. Thank you for that. Yeah, support that.
So we could make a note of that, and we'll put that as one of our recommendations. Councillor Henshaw, you were next.
Thanks, Chair, for bringing me in. Yeah, well, I've read this report, and obviously I was at Cabinet when it was passed, and we've had deliberations in Council, and I know Councillor Bond is quite vociferous in his ideals that he wants to improve the life of people who use our services, particularly people with a learning disability that's outlined in the report. And I know the report covers more than that particular band of people, and it touches on people with autism and other disabilities. And I think if we implement the majority of this plan, I think Nottinghamshire could be one of the best places in the country for people who have a learning disability to live happy and healthy lives. In saying that, I have a number of concerns in relation to the report. The particular issue I struggle with is there's an emphasis in the report on moving away from building-based support. That's quite clear. I see that as the direction that we're moving towards, and that causes me some great concerns. Because if you look at the response to the survey, one of the biggest responses was from the people that actually use the services. They value the services that they're receiving. So you can't have any greater indication than the people that's actually using the service as a reflection of what's actually being done in the buildings. In fact, I think it was the second highest response, and I always struggle with statistics and probability. But if 1,500, 1,400 people have been consulted, and the highest on the sheet is 3941, I just wonder how that sort of matches up. And perhaps James can enlighten me on that issue. Maths has never been arithmetic never been one of my strong points. But in saying that, the other issue that I really sort of find difficulty with is there's a definite emphasis on moving towards using personal assistance in the report. Now, I know that it's clearly evidence that there's a difficulty in recruiting care staff. There's a difficulty in recruiting personal assistants. There is, and we've all acknowledged it in this chamber before, there is a crisis in care, and that leads to the issue of, if we're going to emphasise personal support, how then would an individual access that support if they can't get anybody to actually do the job? It's one of those things, we've got to be really mindful of that before we say that is one of the major ways forward. And the other issue is, are we definitely sure that people want to use more community-based services? Because, and it's outlined in a report in relation to the pandemic, since the pandemic, a lot of the community-based facilities and places to go have actually struggled to stay open. So there should be an emphasis now from people that actually use the day services to actually get in the community now. So we should be doing that. Now, whether or not that's because we haven't got enough staff in the day services to take people out, and I'm talking predominantly about day services that we have, the day services, not the private ones that we work with. I'm on about the ones that we provide. So I have a concern about that. I'm not opposed to getting people out in the community. I think it's a valuable and noble aspiration that we do sort of get people, rather than being in a centre miles from anywhere, we get them out from there into the community. But I'd say that sometimes when we do it, you cannot expect 1 or 2 members of staff to take 10 or 12 people on a minibus into the centre of Mansfield and then have a meaningful exchange in the community. You've got to be more specific, more person-centred, small groups of people and staff in proportion to the people that you're taking out. Now, it's in the report that we should be paying a big emphasis on person-centred planning. Now, we should have been doing, and I think we do, that is not a panacea. The thing is, we should be doing person-centred planning, putting the person right at the centre of everything we do. And that should be happening now. Now, whether or not we can make that better, it says in the report everybody would have an individual plan. Well, if they haven't got an individual plan now, then there's something wrong. They should have an individual plan. And that individual plan should have a key worker and it should have somebody to implement it. So that's another issue. I think it's getting cloudy. We should be doing that now. And the big issue for me is this report and all of our deliberations, and we've touched on it, Matt, the report does nothing to address the issue of low-paying care. It doesn't even mention that issue. And I think that should be what we're doing as a scrutiny committee, looking at why people aren't entering the care profession. And I would suggest that one of the big reasons is not because they're not caring and compassionate, it's because they can't afford to do the job. So that in itself causes me great concerns. And until we resolve the issue of social workers' pay, we'll never resolve this issue. Now, in relation to the report, this says there's been an equality impact assessment, right? That's been undertaken. And I don't know what happens with these equality impact assessments. We see them on the end of reports and we never really see one. And if you look on the County Council's website about it, it's never updated. So if there's been an equality impact assessment or an equity impact assessment, whatever you want to call it, I think we as a scrutiny committee ought to be looking at that. But we never get sight of them. So I think that should be a recommendation that we actually look at these. If there is an assessment that's been done and undertaken, we as committee should see it. So while I agree with the recommendations, Chair, I still think they're a bit woolly. I still think they're a bit nebulous and a bit cloudy. And I'd rather see that we mention in our recommendations that we as a scrutiny committee should scrutinise the ongoing activity of the portfolio holder and the issues around social care. We should scrutinise it and then come back. We should go to them and seek further information if we need it. We should look at the impact that this is going to have on day services, the day services opportunity strategy, and then make sure we look at it in depth and make more recommendations to Matt. Because by us scrutinising it and the decisions that the Cabinet make, that will make the decisions that they make better for the people that we're trying to support. So there you are. In saying that, Chair, thanks for ringing me in.
So thank you, Councillor Henshaw. Not surprisingly, a really good canter through lots of the tensions, principles and ethical issues around this area. So if I might, I'm going to ask Matt to comment on workforce, provider market management, because it was agreed on Cabinet on Thursday, some of that strategy. I'm going to ask James to come back on the statistics in a minute and Bridget to talk about PA recruitment. I'm telling everybody so they can remember what's in my head right now. So I'm going to pick up on some of the issues. First of all, this issue about are we clear about the buildings based. So I think in the narrative that I gave, that James gave in a bit more detail, what we have for this group of people is diversity. So we have got a group of adults around my age with very elderly parents who have had a relationship with us all of their lives. So they've had a relationship with the council for 50, 60 years. They particularly value a service where they know where it is, operates at a fixed time, it gives the carers some respite, they know their loved one's safe, and that gives them the security they need. So that's your sort of your classic person who wants a building based service. But we also know that younger adults aren't choosing our day services, whether that's inside or outside, because they haven't modernised in the way that we would like. And they are based around sort of a schedule of activities. So they're not based on me coming to the centre and saying, well, I want to be able to do this type of university course or do that bit, or I need to do a sensory room for 2 hours a day. It's kind of based on the menu of activities. So the task we've got is to personalise it further. It's not that people don't have a personalised plan, they do. It just doesn't go to the degree they want. So when I did the big conversation in Broxtowe 2 weeks ago, two of the people there, and different ages actually, one was my age, one was somebody much younger, said, why is the support fixed to being 10 till 3? I want to go out in the evening. One of them wanted to go to bingo, the other one wanted to go to a gig, wanted to go to the pub, to the student union in the evening. We can't support that because all of our investment is in that service day to day, which is a bit about needing to expand PAs and to think about the flexibility. Because some people want to have just a life, go to the football on a Saturday, go to a gig on a Friday night and be able to engage with that, but they can't do that without that support. There's also a reality, I think, about supporting Nottinghamshire to be a place that welcomes people. And, you know, it would fill me with dread thinking about a bus that arrives in Mansfield that tries to drop off 13 people together. It's awful, isn't it? That kind of institutionalised view of it. But there is also a reality about how accessible facilities are for people with mobility needs, whether there's a change in spaces, toilet in the facility you go in. There's a whole reality of constraints. So alongside this piece of work, we know we've got to do that bit about making Nottinghamshire in all of its places more accessible, more welcoming, able to speak to people with with needs, or speak to somebody with a PA. There's a whole range of stuff about that disability awareness. You're absolutely right about personal assistance and the supply of that workforce. So we've had work that's been trying to invest in that. I think James has been involved to some degree, but Bridget certainly has been reviewing how well we're doing. So I'll pass to Bridget to talk over. But that bit about having somebody with you to support you where you want to go is the sort of the link with that buildings base. Because the buildings for some people, PAs is for something else. But you're right, it is a workforce that we need to invest in, that train to support. And employing PAs is quite a complicated thing for families to do. There's a whole range of things, but like I say, Bridget can quickly run through some initiatives we're doing to support that. So I think I've cantered through some of the issues, and then I don't know who wants to go next, but maybe Matt, if you wanted to comment on some of the workforce, and I'll ask James statistics, Bridget PAs.
Thank you, Paul. I appreciate your commentary. I don't know, as you referred to the ramble, I didn't think it was brilliant, Paul, that you do care about these services and you also bring your personal experience to them in your professional life, which is greatly appreciated. For me, the whole aspect of pay is, of course, central, not only to this paper, but to everything that we do in adult social care, because at the end of the day, we can't deliver any services, can we, if we don't have the workforce and the staff to do that. And so it's absolutely vital that we do all we can, and I'm quite pleased with the track record in the last few months, although of course we can go much further in having agreed the pound uplift as we did last year early, which has made a real difference and helps us to bring stability to the marketplace through this difficult winter. But as Mel alluded to also, I'm sure you're aware, last Thursday Cabinet did approve 4 recommendations around market sustainability, and we also agreed the fee uplifts for commissioning of care from the 3rd of April. Again, doing all we can to ensure that our staff are paid the maximum amounts we can, and of course we also need those levers to ensure that then passes through to the care operator. So it's ongoing work. Massively appreciate your support in that, and we're on the same page. I wish we could do a lot more. Wish we had a lot more money to spend on our valued staff.
Yeah. Thank you for the question. I think you raised some very important points, actually, Councillor Henshaw. The consultation exercise tried to extract what people themselves or their carers thought about what was important to them in terms of day opportunity access, which is obviously very important. We understand that. You are quite right. The second highest respondent in one of the questions was a day service. Is the thing which is really important to me, and that was I've just looked at the report from is 41% of the respondents stated that very clearly to us. We also recognise that because of the breadth of people who access a day service, and I think it's really important we ourselves as a department think about this. It's not just a one size fits all. We have a number of services, internal and external. We have a range of people with a range of support needs who access services for different reasons. So when we think of it in a kind of a big picture sense, it's not a one size fits all. And what we know is for some people, community access is likewise very important to them. So 25% of the respondents reflected that to us. And we know that's quite consistent with the CQC, so the regulator's view on how people with support needs and disabilities should be supported in the community. And it shouldn't be, I think you made the point of kind of in a building miles from anywhere, disconnected from the communities. Certainly not the vision I think we would share at the County Council. We want people to be supported. And I think the evidence tells us that if you can align people to feel part of their communities, to feel supported by communities, you can generally understand that people may have good outcomes and feel part of the communities they live in. So I think it's an important point, and certainly something we reflected within the approach. I'll pass to you, Bridget.
Thank you. Just picking up on the direct payments element and totally recognising that it can be quite a minefield to come into. We've got a direct payment PA team, and what they actually do is to support people through that process. So it can be quite overwhelming to employ your own person. We've got the ability for the teams to help through that, so you can come through the council for that, you can get that extra support. And what we are seeing is some traction there. We are seeing more PAs coming through, wanting to be people wanting to become PAs, employed by individuals as well. So to me, there is a success story there. As you rightly mentioned, it's challenging to get care workers, but actually what we're seeing is we're starting to see people come in wanting to pick up a number of different roles, one of which is PAs. So it's quite positive at the moment.
Just a point on while we're talking about, I had a little point that I wanted to ask about, and that was equity of access, particularly in rural communities and semi-rural communities. I'm thinking about the north of the county as much as anywhere else, which is extensively rural, and how we ensure equity of access to our services.
Thank you. Yeah, again, it's a very important question given the rurality of the county, particularly north, as you say. So when people are assessed or being reviewed as having support needs which may require a day opportunity, it's important our frontline teams, our social workers, consider how that can be facilitated. So sometimes there are specific transport arrangements made on a bespoke and individual level, but we've also looked at the range of where services are. So what we know is we have a proportionate of most of the externally delivered services in the mid-Notts range, so Mansfield, Ashfield, Newark and Sherwood, with fewer services in the Bassett Law area. We do work with providers, and we've had some really good examples through the pilot project where providers don't necessarily have to deliver a full building-based service, but they can deliver what's known as hub models. So they can, perhaps for a few days a week, go into a particular community to support and enhance the offer. And what that is enabled them to do is have potentially different and better economies of scale of how they use their workforce to support. And I think it's really important the relationships we have with our external partners and providers and with our internal workforce is really predicated on our understanding of where and how people require support. So it's certainly something we reflected in our analysis. And when we review on a quarterly basis the returns, it's very important we also reflect as one of the lenses how far people are travelling, where do they live, to where do they access a day opportunity, so we can really get an understanding in an evidence-based way of is this a disproportionate problem or issue for some people or areas in our community as opposed to others, and then that will support our thinking from a commissioning sense around how and where we may wish to support and facilitate new opportunities or services.
Thank you. Councillor Carr.
I'm particularly interested in that we want to extend to be able to help people to go to gigs. And I have to say, I do pity the officer that has to sit through Michael Bublé for 2 hours. That's going above and beyond. And also, I saw a very, very positive example of what's happening in the department now. When we've got a brand new, how would I put it, an ice cream pudding outlet in Beeson called Massams. And I attended the opening, and there was a county council officer there, and she was supporting somebody whose first night at work it was, which I thought was absolutely excellent and shows that we do, as an authority, care about looking after these people. Just a couple of things I'd just like a bit of reassurance on, if that's okay. 7, paragraph 7, it says that the day service offer is well valued by people, but then says that we can't always give the choices of which you've kept. Just a reassurance, really, that we're not looking at actually scaling back on the buildings, because there were a lot of people, and the pandemic highlighted this enormously. I had 2 particular families that were desperate because the carers, the parents weren't getting any respite at all, and the adult child was desperate to go back to and they were phoning me and emailing me probably weekly, just really to get a chink of light at the end of the tunnel that there was going to be an end to all this. So that's an indication that to a lot of people, this service is really, really important, and I wouldn't like to see that diluted in any way. And the other item is pounds 23. It says there that it can be developed in some locations which have appropriate environments. Can you just explain to me how it's going to be developed in areas that haven't got those appropriate environments, and to try and avoid, if you like, a postcode lottery? Thank you.
So I think we are saying we do need to fundamentally review how we provide services, and that would involve then looking at the premises that we support people from currently, because we know for both some of the external services and so from our internal ones, they're not in locations or venues or set up in a way we would do that if we'd built it now. So some of them are in industrial estates. You can only get there by a council bus, for example. So we do know we need to fundamentally review that, and we also know that people will have different choices now. So what was fit for purpose 30 years ago, and most of our services have been there for quite a long time, isn't now. So I wouldn't use the language scale back, because what we're saying is we need to invest in the support, but it's a different type of support. So it's going to be looking in different ways and tackling that issue of access, to rural communities where there isn't a sensible way of providing a building-based service. It's not necessarily what people want. So that's what we are developing over time. And so that slide that James showed about the internal provision, we'll be looking at where we focus some of that sort of actual community presence. What people are saying is they want things that are much more flexible, and we've heard that response both from the carers consultation that was agreed at Cabinet this week, and through this work, people want flexibility of support. But as you've also heard, the buildings bit is important for that group. So it's about how do we make that resource work for the biggest benefit and the diversity of need.
Thank you. Councillor Martin?
Yeah. Sorry, wrong button. Thank you. Yeah. Obviously, the pandemic has evolved the process and highlighted issues within the existing service prior to 22. So you're tailoring the service as an ongoing process, which is like checks and balances as you go along, which is a very good, robust way of continuing with it. I think it would be good for us to sort of, as a county council, to showcase how we help people through the employment side, because I don't think Councillor Carr touched on that. I don't think we're showcasing enough, because that potentially may encourage other businesses and companies to help us. And I think I'd like to say it's a very diverse service with a diverse age range and a diverse range of things going on. I think it would be very good for county council to see where people in at the 1400, how many and where they are employed in the future, as a result of your evolving process, and I can see that the pandemic has moved people away from building based, really, that's the thing. But on the flip side, that provides respite care for parents, doesn't it? So that it's a very finite line, and the personalisation is there is already a personalised case for them, but you're enhancing it. That's where I'm reading it. But I'd like to see in the future if you come back with where we are employing them and how because in the past that got reduced a great deal. I think from the past. So that's what I would like to see where we're actually sending them.
So if I might, I think what I'll ask James to do is to ensure that in the benchmarking piece what we described that we will identify the employment outcomes. But I think what I also want to acknowledge that our employment strategy is a different strategy but linked to this. Now there was a piece of work that I led as a corporate director just before the pandemic. In fact, I think I had committee sign it off a month before, which was the employment and health strategy. And we are now looking as a council to try and refresh that. So that's a cross-council bit. So it involves elements of public health, involves elements of economic development, involves elements of education skills and children's and families in terms of preparing for adulthood. So we are reconvening to have a look at that within the new council plan. So what I would suggest we do is to think about how we might look at the adult social care and public health elements of that strategy when it's had that reboot. Because like I said, we agreed it in 2019, and quite honestly, Jonathan and I had other priorities up until very recently than implementing that. So it's something that's really important to us, and I think something that as a council we really need to develop. And I would say that would probably be more of interest, Councillor Martin, than having a look just at adult social care outcomes, because I'd suggest we want to have a look at the broader range of outcomes, but how we support people in Nottinghamshire into work rather than having a look at very specific ones. We're very happy to do either, but that would just be my suggestion of how we might do that.
Mr. Chairman, can I just intervene? I did ask.
Excuse my ignorance, Councillor Carr. Could you just repeat the question?
Yeah.
Thank you.
Mentioned autism support will be developed in some locations with appropriate environments, and I basically said, how is it going to be implemented where there isn't specialised environments?
My apologies. Thank you. It references so specifically when we think about the support needs and the complexities around either autism, specialist autism support, or dementia. We know sometimes there are environmental factors, room sizes, entry and exit points, anti-ligatures, some really important environmental features which are co-designed within the support people receive where there is complex support needs. And I think there was a specific reference both internally and externally. Some buildings potentially aren't the right environments or maybe fit for purpose for the type of specialist support. So it just references where potentially we would have to reimagine how a building could be used. There may have to be either changes or considerations given around it would be prohibitively too difficult or impossible to change a particular type of building, but buildings B and C might be more suitable. And the way we would, from a department sense, tackle that is we would use our occupational therapist and really try and think about from an assessment of OT requirements how and where we could support people, being as creative as possible, but recognising there are some barriers to supporting people with specialist support needs and the risks which sometimes sit within those support. Thank you.
Thank you. Councillor Guilfoyle.
Thank you, Chairman. Just on a couple of things. First off, I agree with you, Chairman, about benchmarking and getting that data to look at. But also, is there something about looking about the equity access that you mentioned and whether a report ought to come on that, looking at how the rural communities and others, because it is a specific issue and it is one that does concern. And I think the key to me is where you were talking about, need to modernise and look at the service, and clearly social care is an area that changes very quickly, and we have to be fleet of foot to be able to deal with some of the issues. I agree with the mixed economy in the sense of and the personalisation of it, but think that for me anyway, the personal assistance bit, I just wondered, you did sort of just discuss that a little bit about the qualifications that they need and the training that's required, because in some cases it's different from as you say, going to a football match with somebody or going out elsewhere, there are other people that need more intensive care. And I just wondered what programs were available and what we're doing and working with colleges. I know there are social care classes in most of the colleges locally, and I just wondered how many of them are geared around being personal assistants. And I know some of the difficulties that people have had trying to get personal assistants. Some people have tried it out and then have gone, and when they've got personal assistants, if they fall ill, trying to actually get people to replace that personal assistant is very difficult at short term. I know someone who literally has to travel from where they live into Nottingham to live with one of their personal assistants for a period when some of the local personal assistants can't come for whatever reason. So I think, I'd like to see a little bit more work around that coming back, so that we've got a proper career structure for them in that sense, and properly qualified. And then just in relation, I know probably I'm a bit getting a little bit old fuddy-duddy like most people these days, and buildings has always been something that we always focus on, and that's where, as I've been here a member for 20 odd years, have seen develop. And I'm just wondering whether you're saying to us, actually, we need new buildings now. We need to modernise the buildings to be able to deal with the issues that we've got, because I think you'll always need a building. You'll always need something somewhere because of the cross section and the range of problems that individuals have. And I'm just wondering, is that the case, that really in reality it's not about, because when you look at it and you read the report, you think, oh, they're going to get rid of the daycare centres. Or are you saying, actually, we're going to modernise them? Do that. So, but very keen on seeing some of the, not just for this committee, but for some of the other committees, the benchmarking, because it's not very clear sometimes what we're managing. But thank you. That's all.
So I'll pick up a couple of those issues, and I'll ask James and Bridget to comment in a bit more detail. So I think we're saying we need to do all of those things. So it's about changing some of our buildings, using different buildings, and we don't necessarily need to have those as county council buildings. So elsewhere I've worked where there are these innovative hubs, which are community spaces that involve a whole range of partners, in which we can then deliver adult social care from, because the needs are so diverse. So I may be somebody that's just come out of long stay hospital. I may have been in hospital for 20 years. I might have had a criminal conviction, which is why then I went into NHS services, and then I may be being supported by 3 staff. And as James mentioned, the ligature points, the environment has to be safe and secure. So we need that safe and secure facility, but that might not necessarily need to be in a day centre or day service. That could be some other building. So we need those very bespoke individual opportunities. And then for those that wish to have their services delivered in groups, because not everybody does, but some do, we then need to be able to have some community facilities that enable group activities to take place, and then a whole range of things in between all of those scenarios. What I don't think we necessarily need to do is to build day centres that have hairdressers, nail bars, cafes, when those sorts of things happen in all of our communities. One thing we won't be doing is accessing vaping shops, but there are, if you think of any high street, will have those kind of facilities. So why would we recreate that in a day centre? So I think it's all of those things, Councillor Guilford, that we need to do, is to reimagine our spaces, to look at where we can tap into community resources and support people to operate in different ways, and also create very bespoke environments. And I'll ask James to just comment on how we're reviewing, concluding some of that. And then PAs, that it's a bit like it's a match, so it's less about skills and qualifications than it is about a matching of I suppose rapport, because the PA and that person are going to be almost living together for quite a considerable time. So it's that matching bits. If I'm an older person with dementia, if someone supporting me with that will have to have a very different set of qualities than if I'm in a motorised wheelchair and I'm unable to provide a lot of personal care. So there's something about having a very basic bit and being DBS cleared, and some of our structures help with that, but also then are helping both PAs and the person drawing upon care and support to understand how they might work through that matching process, because it is, as you've identified for those reasons, quite difficult. But I wonder if James or Bridget, you've got anything to add?
Yeah, thank you. So I was personally very much involved in the engagement and consultation, and I think it's very important to understand what was reflected back to us. And I think a distinction I took away very clearly was these are some of the most vulnerable, arguably, individuals in our communities, and it's very important that we get the offers right to ensure that their needs are supported. Some people were reflecting very strongly that buildings and that sense of safety was very important, and so to go somewhere, that regularity, the familiarity of the same faces, the same environments, was something very important to them. But there was also a number of people who, for example, the building wasn't the main thrust of why they cared about being there, but the people within that building was the thing they really valued. And we felt, certainly as I've reflected earlier, it can never be a one size fits all, and this is the approach. It's nuanced, and it really centres on what people who use those services, carers, staff, really feel could be achieved. And so if that means some people, as we say, over the course of time, may decide that a building isn't the thing they really care about, but it's meeting friends, it's accessing sports clubs they can't access at the moment, and the range of things within. But I certainly feel for some people, it was very reflected strongly to us that buildings are important for various reasons, and we see that pronounced perhaps more so within autism, where the kind of structures and routines for some individuals, again, is very important in terms of their care and support needs. But we also saw with some particularly younger people who may have learning disability, who have come through from children's and transitional services, that they're in a day service, and actually potentially the potential and opportunities in the future for them could be further than just attending a day service. And I think it's something they were very receptive to thinking about what the future could look like for them as well. Thank you.
May I just come in on that? Oh, do you want to? Sorry.
PAs as well.
Yeah, I was going to. Just to say that from a PA point of view, that match that Melanie was referring to and James was touching on as well is really key. And a lot of this is around accessibility, getting people to be able to go out and about in the community. So, but actually, it is the tailoring of where someone lives to where the carer is. It is really important about what that PA, as well as the person, what does the PA want to do? So it's getting a little bit of their vision as well captured, and then marrying that up. So it's quite an art, I think it is anyway. Qualification wise, it's very much around your level 2, level 3 qualifications, and then anything specific that you would then need training. Obviously, your safeguarding, obviously, all your mandatory training you would expect. But actually, it depends very much. Again, it would be personalised to that person. It has to be. So, as you say, it would just depend on what that person wants to do, needs to do, and then how that PA is able to support them to do that.
So just thank you for that, and I understand that, and I thank you. Just in relation to the buildings, one of the difficulties I have on that, about working with the wider public sector and private sector, is that recently most authorities are getting rid of their community buildings because of the fact that they can't afford, because of increasing prices, etc., to run them anymore in that sense. Many community buildings, well, we know most of the community centres are usually subsidised by local councils themselves, and they can't afford the subsidy. So they're getting rid of a lot of those centres right across the board, which means then that, you know, the opportunity to work in partnership has gone by the way. I mean, you know, even the police force got rid of all their buildings, and now everybody's clamouring for them to come back. You'll see, but you know, it's a difficult one. So I think it's going to be hard to sort of find those community buildings as well, without actually saying, well, we ought to look at being self-sufficient and modernise our own, or look at where they are best suited, and a proper capital programme around that.
Councillor Henshaw, you wanted to come back?
Thanks for bringing me back. Yeah, obviously, I mean, this is an important topic. It might be a once in generational plan that we look at day centre provision. So we've got to make sure we get it right. And I mean, I can remember the bus coming to end of our street, picking up a person with Down syndrome, and then taking them off to somewhere miles from anywhere, and then bringing them back at 4 o'clock and dumping them on pavement. And thank goodness society's moved on. I mean, last night at the Oscars, we had a chap with Down syndrome being nominated for an Oscar. So with the right conditions and the right support, people with Downs can live full and active lives. And people with disabilities aren't shipped off to special schools. They're actually taught in schools, and they're integrated and they're looked after, which is the right thing to do. So when you look at this day opportunities model, early intervention, I think, is primarily a topic of importance, because if you're, and we've got to work with other agencies, which I know we do. If a family have a baby with a disability, then they've got to have early interventions and be directed into places where they can get support. But it's not just people that have children early intervention. I've known people come to the attention of the local authority that have been living with the parents, and the local authority basically don't know that they exist until the parents can't look after them anymore. So that's another issue where you've got to have early intervention. So it's not necessarily about, the age thing. Enablement, totally important, and everybody around in this room would agree that you can enable people to do things, but you've got to target the support to that individual to make sure that that individual's needs and wants are catered for. You can do that in day services if you've got the trained staff and you've got the time and you've got the vision to do it. I've took people with learning disability in helicopter rides and down to London. All these things you can do if you've got the vision to do it. And one of the biggest issues in relation to people doing things is assessing the risk. Assess the risk. Because very often risk assessments are put in place to stop people doing things as opposed to allowing people to do things. So that's another area which has got to be looked at. Very important. Assessing the risk, making sure that risk totally looked into, and then you can enable people to do something. Now, the issue on personal support, which I still have grave doubts about personal support, because some of the people that we're asking to employ people, they've got to be in a position where they understand what they're doing. So by nature of that, you've got to have somebody there to support them to make that decision. Now, a personal support worker, right? It touches on all the other themes. You assist a person in their daily activities, basically so that that person can live an independent life. So therefore, it's very important. Now, why can't we work with or commission with some of the big charities who have well-trained, highly motivated staff, overworked, I must say, and then let them provide individual personal support to different people? That is a way I think we could encourage people to have a personal assistant. They don't necessarily employ them. A company, a charity employs them and then links them in if the person wants to do that. So that's another avenue we can look at. And the other issue in regards to buildings, I am not saying that everything that goes off in a building should be cut and dry and sacrosanct, because by nature of the fact that you want people to go in the community, the possibility that buildings may need to be reviewed and they may need to be adjusted to cater for that. But the other problem, or the other worry I have, is that at the bottom of the triangle, specialist intensive support. Now that's a small bit of the triangle, but it's a big issue. It's a very big issue, because are we saying, Chair, that the only people that we have in our day centres are people with profound and multiple learning disabilities, because it's very difficult to get those people, those individuals, those human beings out in the community. So let's move forward. Let's modernise. Let's look at ways of supporting individuals, because that's the way forward. I just sometimes wonder that. I know with Councillor Varner pushing it that individuals and people will be thought of, but anyway, those are my concerns. Thanks, Chair.
Councillor Barnes, do you want to come back and?
Well, I don't need to, because of Councillor Henshaw's last line there. That's exactly what I was going to say. We are in a really, picking up on your comments as well, Councillor Guilfoyle, where in a privileged position here at Notts County Council. Our budget, thank goodness, isn't in such a state that we have got to make cuts just because of cuts' sake. This is entirely being driven by what is the right outcome for the individuals and the service users. And as James so eloquently said, these are some of the neediest people in our society and community. The last thing I'd want as a result of any of the conversations in this chamber is to cause those people any worry or concern or sleepless nights. It's not needed. This is about actually making our services fit for purpose, modern and appropriate, putting the individual at the centre of them and tailoring them so that there's a localised approach. So you're not put on a bus and sent somewhere to Timbuktu, but that you can be supported where you are. And just in response to the comment you made about the third sector and charitable, we obviously are already working with a number of groups. I totally agree with you. The more we can do that, the better. So I really appreciate the honest debate here and the challenge. This is a once-in-a-lifetime opportunity. Let's make the most of it. Let's get it right. Let's get the best services we can. I've got to apologise because I've got to go to another meeting, but it's not that I'm being rude. I was invited only to come for this section, but I'm already late. So if with your permission, Chairman.
Thank you, Councillor Barr. You did mention to me at this earlier on this morning that you were time limited, so thank you for staying a little bit longer than you actually indicated you could stay, and you're free to go. Councillor Carr.
Can I make a suggestion for something else? I know you've made about the benchmarking, which I fully support. I think something else that perhaps we should be looking at is obviously at the moment there's a lot of reviewing of individual properties and the services that are provided there, etc. It would be really useful if we could see the ongoing reviews. Now, I appreciate that will probably have to be as an exempt item because it's very sensitive and we don't want people to set hairs running. But that, I think, as individual councillors on this committee, what is being looked at for properties would be very, very useful.
Sorry, can I just check out what you have in your mind, Councillor Carr, but what we're sharing? Because obviously it's not appropriate to share individual review in outcome.
Oh no, I mean what an actual building is going to be providing in the future and what plans you've got for any alterations, what you want to go into there in the future, etc. Not individuals.
The implementation plan of the strategy, because I think that's certainly possible.
Have to go into exempt because it is sensitive until it's finished, isn't it?
I wouldn't. I mean, that depends on what it is. I wouldn't have thought so, but I think certainly if we're bringing back the benchmarking at that point, I think it would be appropriate to bring back the implementation plan to this committee.
Thank you. I think we've had a robust discussion and debate. Martin's been taking suggestions from me and suggestions from the floor. We've got a list of things that we think we need to come back on. We have a review of this issue in the diary for September, and with all the other bits and pieces that we've actually highlighted today, it may be that the agenda for adult social care on its own for that review may be enough to fill the meeting, but we'll review it as we go along, because I want to make sure that we have a full and frank discussion about all the issues that we've raised. And if it means that we have a one issue agenda in September, then so be it. But obviously it's a wide ranging issues that we're looking at. I'll just ask Martin to go through the recommendations that we've got, and if we've missed anything, if anybody wants to shout up, then we'll put them all down and have a vote at the end of the.
Couple of things. Just to note, there were some concerns about staffing. We have got to report schedules on the social care market on the work programme to bring an update. We did say September, but that is towards there, so that is an issue that the committee will be looking at again. These were written down as we kind of went through the meeting, so they may not be in the ultimate logical order that they sound, but I'll go through them as we've got them. So obviously that the committee notes the report, and then the following action points are that a progress report on the implementation and performance of the Day Opportunity Strategy be brought to the September 23 meeting of the committee. B, that members of the Adult Social Care and Public Health Select Committee receive a written report to provide further information and assurance around the processes that will be in place for the monitoring of the performance of the strategy. C, that the equality impact assessment carried out in relation to the Day Opportunity Strategy be shared with members of the committee. This activity takes place to ensure that all relevant equality impact assessments are made available on the council's website. this report on the equity of access to the opportunity services be brought to the September 2023 meeting of the committee. And then finally, that the progress report on the implementation plan of around the day opportunity strategy be brought to the September 2023 meeting of the committee. Hopefully I've got anything else there, but if I haven't, please let me know.
Have we captured everything there?
Yes, Chairman, I was going to save these remarks until perhaps the next item, but none of that that's been read out is scrutiny. It's all reports. We've spent an hour and 10 minutes and there's not been one element of scrutiny, quite frankly. It's been a report, interesting, informative. I'm not disputing that. And the next report is going to be exactly the same. But that's not what scrutiny is about. Reports like this would have gone to the adult social care and what committee it was. What we need to be doing, a number of items have come out. This next item that's coming up, I think there is some scrutiny work that could be done on that with regard to the effectiveness of the programmes, value for money. But you don't do that in a full meeting like this. You have to set up working groups, you have to take in information, you have to have people in front of you to be questioned. And all of these issues that have been raised in themselves may be valuable items for scrutiny. But bringing a report to the next meeting isn't scrutiny, it's just a reincarnation of the old committee system. And I didn't think that's what this was supposed to be about.
Thank you, Councillor. But we are in the process of setting up individual working groups on issues. We've been trying to set some dates up on about a particular one, but some of those issues that have been raised today may give rise to us setting up a working party to deep dive into those issues, particularly about monitoring and how we use metrics to measure performance and so on, which is what which is what I agree with you, that is what scrutiny is about. We should be looking at how all the money that we spend on adult social care in this particular field is being spent, and is it being spent wisely, and is it producing results? But we need to get the report and metrics to decide that, and then we need to be looking at specific individual issues and setting up working groups. I mean, we are trying to set up one jointly now with Councillor Smith's scrutiny select committee. So there are, I agree, lots of issues that we need to be looking at in more depth.
Thank you, Councillor Quigley. So I was going to suggest that September didn't feel right timing for me, but I think a working group, having a look at the progress implementing it, the benchmarks, the evidence, will be a much more interesting piece of work. Because I think if you think about our timeline of implementation, in order to work backwards from when the report's done and the data we've got, I think it's going to be quite meaningless. So if Councillor Owen's suggestion is recommended, I think we'd be really happy to be having a working group on this topic as opposed to coming back in September. I think it would suit everybody's purpose much better, and then we can consider the buildings, the issues that have been raised here, and just have a look at what that means, particularly in relation to individuals' needs and the diversity of need.
I think you were probably misunderstanding what I was saying, but in the interim between now and September, those issues do need to be looked at with working groups, and Martin and I will be trying to set up working parties to look at those issues, and I would expect those to be reported back by September.
That's fine, Jim, but that's not what was said by the scrutiny officer. We were told we were going to get reports on this, that and the other. And I don't want reports on this, that and the other unless it's been through a working group, scrutinised and come up with conclusions that will inform the cabinet member.
I agree.
Yeah, Councillor, who has first experience of this because you chair many working parties at Broxtoes over you in scrutiny, and it's there. Actually, individual members can suggest items for scrutiny, which then go to the Overview and Scrutiny Committee and a working party set up. Perhaps that's the direction we should be going. A cabinet can suggest items to go to scrutiny, and I think that's probably the way forward.
I mean, we can add a recommendation about setting up, but we have to get approval from Overview for any working group to be set up anyway. So we'll need to go through the process. But I completely agree, because at the moment we're not carrying out what I consider to be scrutiny.
Yeah, thanks, Chair. I agree. Well, then, can we make a request to Overview and Scrutiny that we set up a working party from this committee to look at the implementation of the future of day centre provision? If we did that and it was granted, then we could visit the buildings, we could talk to staff, we could talk to external providers, we could talk to many people to get a steer on on how things are going. Talk to our own officers, and then at least you've got some a piece of valuable work that could either possibly support what cabinet's wanting to do, or possibly give them ideas on a slightly different direction. So I'll ask if other members agree, then we can do that.
Councillor Guilfoyle.
Yes, Tim. I mean, obviously that is the way forward. What I would suggest, though, is that actually, in Overview, as members who sit on Overview, we looked at a number of issues that we would, over the course of the period, like to review, and then we prioritise those in order of what we would wish to look at, so that we've got some. So I don't know whether this is the most burning issue that you've been dealing with adults and social care. I know it's important, but I think you also have to give consideration to that, and then perhaps come up with a list of things that you wish to, over the next year or so, wish to scrutinise, and then you know that, and you've got your work programme then. And as Councillor Owen says, rather than coming to a meeting with a set of papers similar to what we would have had a committee, what actually we'd be doing is coming to actually scrutinise, because you had already set that out.
Councillor Carey.
Yes, thank you, Chairman. I just have one concern. So looking at page 11 of the report, section 13, paragraph 13, we've got the schedule of what we're expecting to do on this. We have revised monitoring and evaluation, and this will align with new contracts from summer 2023. If we're talking about looking at revised monitoring and evaluation metrics, processes, etc., we're not going to look at that and finalise till September. Does that conflict with trying to get new contracts in place from summer 23?
Yeah, thank you. So the revised monitoring and evaluation is part of the new day opportunity framework. So how we essentially commission and work with our external partners is usually defined clearly under two constituent bits: our service specification, we describe what we want, how we expect you to deliver it, and then the contract ultimately. And the thread between the two is contract and monitoring and evaluation. How do we expect to ascertain what you're doing? How do we know if it looks appropriate? So the department has spent quite a lot of time with individuals who use services, a suite of providers who deliver them, to cultivate new monitoring and evaluation, new lines of inquiry, which are developed and built into that service specification. I think one of the challenges for us is to see the meaningful impact. I see it as our specs and contracts are the vehicles we can start to influence how our external parties change their delivery models. And until they're in place, the vehicle to influence them to change isn't in place. And so when they're in place in the summer, it will be an incremental shift in how they're delivering services, potentially more community access. And I think that's something we just have to be mindful of from our perspective. It's not a short term, it's a medium term implementation plan.
So my comment really is that so the contracts that in place will be flexible in terms of the monitoring and evaluation of their future performance.
Yes, they'll be flexible with a range of ways we will assess. So some of that is annual visits to services, return of KPI data, etc. And they can, and there is a term within the contract, we can create or amend those requirements as we see fit on agreement with the external party.
So if I might just add, I think if we're engaging in a piece of work, it's about shaping the policy. So this committee is about shaping our policy into the longer term, which I think is really valuable and helpful. I don't think that will influence in the short term how we operationalise an implementation plan, because I don't believe that's what the working group would be looking at. But I certainly would really welcome this chance to do a piece of work, and I would suggest it's well past September. I don't think September's enough time to do that working group justice, to have a look at how we're going to be taking into account the reviews, the information, how the internal services are developing, to shaping the actual long-term policy. But like I said, the two things are running together, but they're not critical path activities. So you won't delay us, in other words.
I think the danger with working groups is that they go on too long. And I like to set a time limit. If we're having a working group, then I would expect it to report back in 6 months or less. Otherwise, we're wasting our time. So we'll need to look. I mean, there are several individual items that we've put recommendations in today, and I would think that the implementation and measurement of and metrics is the most important one that we've discussed today. That would make a suitable issue for a working group to get the teeth into, and we need to get the agreement of overview that we can set that up. I think it's just a matter of a quiet word with the chairman of overview to tell him what we want to do, or ask him what we want to do.
I was going to suggest you don't have a quiet word in, that you perhaps have a formal conversation with the chairs and vice chairs of all the scrutiny committees with overview and scrutiny, and set up a procedure. That might be the best thing to do.
So with that amendment to include the setting up of working groups, are we content to pass those recommendations? All in favour? It's clearly carried. Obviously they will be published in the minutes, so thank you all for your input. We now move on to agenda item 5, which is the issue that Councillor Martin and I raised some time ago about electronic vapes and the use of those by young people, which has been quite topical at the moment, because it's in all the newspapers, it's all over the television, it's all over social media, and I think most people, if they go by secondary schools these days, will see a group of children outside the school gates vaping away, and I certainly have seen it at some of the schools that I'm responsible for. So who is taking? Are you taking this, Jonathan?
Well, I'll say, if I may, I'll introduce it with a word or two before passing to my colleague Kath Pritchard, who's online. She's actually delaying the start of her holiday in order to join us this morning. Thank you for setting this question for us. What you've asked us to address this morning then is the role of vapes in tobacco control and public health. And before Kath attends to the specifics, really around the use and prevalence as a quitting aid, and also addressing some of the concerns that you've just touched on regarding children and young people specifically, I'll just make brief mention then of tobacco control and public health, because of course the wider context for this, which committee reflected on just 3 months ago at the last meeting, is our statutory duty as a council to take steps to improve the health of the population, the duty that we have to give regard to guidance from the Secretary of State, the fact that that guidance points requires us to take a look at reducing health inequalities and extending healthy life expectancy. And of course, tobacco, notwithstanding the enormous improvements and the reductions in prevalence and use over recent decades, still makes an enormous contribution to preventable ill health and premature deaths. So we need to note that wider context around tobacco control, its ongoing importance for people and communities across Nottinghamshire, whether you're looking at this through the lens of health and well-being or through the lens of enabling communities to prosper. But with that sort of brief kind of introduction, perhaps I'm assuming she is online. I can pass to
I am online.
Kath. That's a relief to me, Kath. With Chair's agreement, I'll pass to you to pick up a brief presentation. Thank you.
Okay, thank you for that introduction. And colleagues, I'll keep my camera off for the presentation part, and then hopefully my camera will work when in relation to the questions. So thank you for the opportunity of talking to you today. I'm conscious that I'm Kath Pritchard, a consultant in public health, but I want to acknowledge the work that colleagues Jane Roberts, Joe Marshall, and from a partnership point of view, the Tobacco Control Alliance do in relation to e-cigs as an opening. Oops. Okay, I'm hoping that that slide has moved on. Can I just check with somebody whether that slide's moved on for yourselves?
Yes, thank you.
Okay, thank you for that. So as a result of the work that you looked at the last meeting in relation to the public health outcomes framework, the purpose of today's briefing is to examine the risks, benefits and use of e-cigarettes, and to highlight for yourselves how we as a local authority are looking to address their use in Nottinghamshire. And as Jonathan's already mentioned, we need to place e-cigarettes in the context of tobacco control, as they are considered a tobacco product. Now, we know that tobacco smoke contains carbon monoxide, over 250 toxic elements, and 69 of those elements are known carcinogens, i.e. cause cancer. And tobacco is still one of the leading causes of preventable ill health and illness within our community. And the take-up of smoking starts in children and young people. And for us, it's a leading driver of health inequalities and disproportionately affects the poorest in our society. So what does this mean for our communities? Well, it's shocking to understand that tobacco still kills around 1,124 people every single year in Nottinghamshire. And as I mentioned, it disproportionately affects the poorest in our communities. So you'll see in that slide around 14% of our population in Nottinghamshire still smoke, but the highest levels are in Ashfield and Mansfield, around between 19 and 20%, and our lowest rates in Rushcliffe at 5.9%. So it is disproportionately affecting our poorest communities. And whilst there's been a massive reduction in smoking over the course of the last 20 years, around 1,000 young people are estimated to have taken up smoking in our community in 2018, and it's estimated nationally that around 200 young people every day take up smoking. In relation to illegal tobacco, in 2021, Nottinghamshire, our trading standard colleagues seized £58,000 worth of illegal tobacco. And each year we estimate that for Nottinghamshire alone, smoking costs us £242 million. And that's not just healthcare costs. So that's costs in lost productivity from people not being able to attend work due to illness related to smoking. It also impacts on our social care colleagues, the impact on fires, and also littering. But the thing is, there are three key things that we know we can do to control tobacco and their products. The first thing that we can do is make sure that our legal and taxation environment is appropriate. Things like controlling age of sale, advertising ban, taxation, and making sure that we don't work with the tobacco industry. The second thing that we can do is from a community point of view. So those prevention activities to control activity in relation to illicit tobacco, smoke-free places, and work with schools. And the third thing that we can do to control tobacco is around services. So supporting people to quit smoking, whether that's through the NHS from the long-term plan point of view, or working with our provider of stop smoking services, Your Health, Your Way, to provide people with the best opportunity to quit smoking through a mixture of nicotine replacement therapy, pharmacotherapy, or e-cigs to help them stop smoking. So what are e-cigarettes then? Well, they're battery-powered devices that heat a liquid to generate an aerosol or a vapour, and most of them contain nicotine as well as a flavour. So what does the evidence tell us about e-cigarettes and vapes as a quit aid for smoking? Well, the slide that you see in front of you there highlights three of the main reports that we work with. So the first that you see there is a report from Public Health England in February 2021 in relation to vaping. The second, a report in 2022 from the Office for Health Improvement and Disparities. And the third, the guidance that we have from the National Institute for Healthcare and Excellence. So what these reviews have told us are that e-cigarettes are estimated to be 95% less harmful than ordinary cigarettes. So 95% less harmful. We need to be clear that we don't know the long-term effects and the long-term harms, but they are 95% less harmful than ordinary cigarettes. There have been noted short-term health effects, sort of coughs, headaches, dizziness, sore throats, and there have been problems, particularly in the USA, with illegal e-cigarettes, particularly with a product in that e-cigarette, vitamin E, that's been banned in the UK, and additions of cannabis derivatives that have also been banned in the UK. So if we're looking at e-cigarettes as a quit aid, then we should only utilise regulated products controlled by the Medicines Health Regulation Agency and those that have undergone tobacco products regulations that have undergone safety tests. The other evidence that comes out of these reviews is there's negligible risk to others from second-hand e-cigarette vapour, and almost all e-cigarette users in Britain are either ex-smokers or current smokers. It's the most popular method for giving up smoking, and switching from smoking to vaping cuts health risks substantially by reducing exposure to toxic substances. So the conclusion that these reports come out with is that the most effective way to support people to quit service is via a service providing behavioural support plus pharmacotherapy, nicotine replacement therapy, or e-cigarettes. And it's been shown that e-cigarettes, when combined with face-to-face behavioural support, are twice as effective as for quitting smoking as other products. But as a committee, you raise the issue about e-cigarette use amongst young people. And we need to make sure we strike a balance between promoting the use of e-cigs and vapes to adult smokers as a quit aid, whilst preventing the uptake among children, young people, and indeed non-smokers. So what you see on the slide in front of you are they are a new category of attractive, cheap, disposable vapes. And these are the products that you see there are, they can be either Elf bars or Geek bars are the most popular. So there's it's illegal to sell to under 18s or for over 18s to buy on their behalf e-cigarettes. But despite it being illegal to sell vapes to under 18s, it's been found by the Action on Smoking and Health that 47% of young people who use vapes buy them from shops or are being given these products. And when you talk to young people, they see promotion for these online in TikTok, Instagram, and particularly influencers who are advocating their use. So what does this mean in relation to what we know in relation to e-cigs and young people? So there are two main surveys that have been carried out. So the first one, the Action on Smoking and Health, Smoke Free Survey 2022, and the second, the Smoking, Drink and Drug Use Survey. So as I mentioned, these are national surveys. And what they both find is that the majority of young people do not use vapes and have never vaped. So the Smoking, Drink and Drug Use Survey talks about 78% in that category, and the ASH survey are approximately 90%. However, they have identified that there has been an increase. So in 2018, approximately 6% of young people were current e-cig users, to 2021, where they found that 9%. So there has been an increase in the number of young people that have tried vaping. But that's age related, and children under 16 are least likely than that older group of 16 to 18-year-olds. So use amongst the 11 to 17-year-olds who've never smoked remains fairly low, and it's largely experimental. But there is some evidence that there is an increase in people using e-cigarettes from those national surveys. So I'd like to tell you what we're doing from a public health point of view. So some work that we've been doing that we've used the public health grant for has been particularly in relation to this area of work that you identified from the last meeting. And this is to give you a flavour of the work that we're undertaking. So the first one that you see there is that we're organising a phased approach to the provision of e-cigarettes. So this is working with Your Health Your Way, our smoking cessation provider. And they're working with smokers who have substance misuse disorders and smokers accessing the lung health check. So they are going to provide e-cigarettes as a quit aid for those who are particularly addicted to nicotine, and to try and help support people within those groups to quit. In relation to young people, we've also invested in age-restricted sales. So we've put money into trading standards to target businesses who are selling age-restricted products. And we're asking them to particularly focus on vapes, tobacco and alcohol to try and reduce the sale to young people, and therefore reducing the detrimental effects on their health of those products. I mentioned the national surveys. We're conscious that we also need to understand what's happening from a local point of view. So these two next areas, behavioural insights and the health related behaviour survey for years 6 and 10, will be local work that we're undertaking. So the behavioural insights work, we're working in partnership with Nottingham City Council's public health team to research, plan and deliver a phased behavioural insights research and social marketing campaign focusing on smoking and vaping. And this will include insight into why young people vape. So we'll get more of a local feel of our population and how we can target future activity. The health related behaviour questionnaire will also provide an opportunity for young people in years 6 and 10 in participating schools. It will be a questionnaire that will include validated questions about vaping from the ASH survey to help identify which particular schools are have a particular problem with vaping, and will provide a rich source of data and help provide a more accurate prevalence data for vaping among children and young people. The fourth item you can see there is the intent programme, and this is to support a programme called Evidence to Impact, which is a smoking and a vaping prevention programme to reduce smoking and vaping initiation by first getting adolescents to engage with anti-smoking messages and then creating personal plans on how to refuse an offer of cigarettes and vapes. So we're working with schools in relation to that, our Schools Health Hub. And the final thing you'll see there is a whole school approach to vaping. So Schools Health Hub colleagues are working with county schools to encourage them to implement a whole school approach to vaping, including policy development, curriculum resources, and targeting support for young people wishing to quit vaping or indeed smoking. From a Nottinghamshire Health and Wellbeing Board point of view, we have done some work with the board to ensure that we get consistent messaging out. And the Nottinghamshire Health and Wellbeing Board supports the safe and regulated use of e-cigarettes as a choice of a route out of smoking for adults without becoming a route into smoking for young people and non-smokers. So in conclusion then, e-cigarettes should only be used as an aid to stop smoking, but our advice is if you've never smoked, don't use an e-cigarettes. Then e-cigarettes are not for young people or for adult non-smokers. We know that e-cigarettes are estimated to be 95% less harmful than ordinary cigarettes, and using e-cigarettes that contain nicotine with behavioural support are more likely to result in a successful quit attempt, and only utilise regulated e-liquids and never risk adding substances. So the clear and consistent messages is around that vaping is substantially less harmful than smoking. So the message is clear. If the choice is between smoking and vaping, choose vaping. If the choice is between vaping and fresh air, choose fresh air. So thank you. I'll stop sharing my screen.
Thank you for that. Couple of points I'd want to make. First of all, surveys are all well and good, but if you ask a 10 or 11-year-old whether they're vaping or not, they're going to say no because they know it's illegal. So how accurate those statistics are about 9 or 10% of young people vaping is and I think the message that we're putting over, that it's 95% less dangerous than smoking, is wrong. We should say yes, it is less dangerous, but why say 95% less dangerous? Because young people think it's not going to do me any harm then, and I just that's my personal view anyway.
Did you want me to respond in relation to those?
It was on. Sorry, please, if you would, please, thank you.
Sorry about that. Yes, thank you. And some of the work that we're doing, you're right in relation to surveys, and that's why we need to get surveys at a very local level to understand, as you've described there, the evidence that we have from national surveys. So we're really keen to understand from a local level what's happening. The second thing that you mentioned, so we're looking at e-cigarettes in relation to smoking and being less harmful than smoking, but we really need to understand the reason why children and young people are taking them up. We know that TikTok and influencers are very key drivers in relation to people's take up of this, so we need to understand that better. Thank you.
Thanks. Councillor Guilfoyle.
Thank you, Chairman. I mean, smoking is an issue I've been passionate about for years, in the sense of being able to get people to stop smoking. I lost my father when he was 54 to smoking, and he'd smoked since he was about 11. He said when he was, and gone through, joined the army, smoke a lot through there and everything else. So I've always had this issue totally against smoking, but understand people do get addicted and that it's not an easy issue to resolve. My concern with this is that I don't think we know the long-term impact that vaping is going to have on people. We've got it's all new. We've got little bits of analysis being done, and says that the effects on people up to date is X, Y, and Z. My concern is that in say another 5-10 years, we'll see people who are really suffering with this, and we've heard of incidents of people with problems with water on the lungs and things like that, and you've read about it in the press. So I'm concerned that, much like Councillor Quigley, the wording that we use seems to point people in, well, this is better than nothing, and I don't think that really we ought to go in down that, but understand it. The other one is about registered, where we talk about in the safe and regulated. I understand that the systems in the UK, the substances have to be are regulated and are monitored to a degree, but when it's used as safe and regulated, use it as safe and regulated. My view that for me, safe and regulated should be that it ought to be on prescription, not where you can just go into a shop. Because clearly you see in the report where 230 complaints, it doesn't tell you the period of time, but it says there's 230 complaints for sale of tobacco and vapes to underage children. And I think that's enormous. And that's probably more than what we probably had complaints on illegal cigarettes that were sold. And I'm glad to see that they've joined up with Trading Standards to do a similar thing as to what was done with the illegal and fake tobacco on enforcing counterfeit substances that could be used, and B, people who are selling it to underage. This morning I caught the 7:30 train from Worksop to get here. Lo and behold, probably 13-year-old, and they were puffing away as happy as Larry, coming along the station, and and that is not unusual when you're walking around Worksop to see very young, and I've seen as young as 8 and 9-year-olds using vapes. It is more prevalent than what I think we believe, or what the survey is saying. I think the other key issue that was mentioned was advertising. I think that what we should possibly do, Councillor Quigley, from this is probably write to our MPs as a committee, saying that would you look at the advertising for vapes, that how it's getting to young people, whether a block can be put on that, where in this day and age, because they're the only people that can actually change the legislation around that. But I think, we talk about doing positive things. I think that's something that we could do, is say to our MPs, this is an important issue. Can you stop this advertising that's encouraging young children to take up vapes, even when they probably wouldn't have took cigarettes up? The other thing is, are we working with a lot of our schools use the DARE programme. Probably not as many as used to, but I know there are a number that still use the DARE programme. And I just wondered whether we've had any contact with them, because they do go into the schools and work with the primary schools, particularly around substance misuse. And I just wonder whether we've provided them with any learning aids around that, so that they can actually assist us in getting the message over at that young age. That's about it, Jim. Thank you.
Thank you, Councillor Guilfoyle.
And thank you, Kathy, for the presentation. Thank you.
Oh.
Yeah.
Thank you. Would you be happy for me to respond to those questions, if that's okay?
Please do.
Thank you. thank you for those comments. They're very helpful, and you identify a really important point there in relation to the regulation of e-cigarettes. So the regulations haven't caught up with the products, I would suggest, at this point in time. So you're quite right. When we look at what's happened in relation to tobacco and cigarettes, it's very different, isn't it? So now tobacco can only be sold in plain packaging, so an olive green packaging. It's behind closed shutters in shops, so it's not advertised. And you're quite right that we don't have the same control in relation to vapes. So vapes are freely advertised. They're not necessarily even behind the counter, and that's an issue. And we've seen a huge amount of success with the control of tobacco through that sort of very stringent regulation and not advertising for it. And certainly some of these new devices that we've just had on screen, they're brightly coloured, their flavours are very, very attractive to young people. So I think you're right in relation to advertising. There needs to be more control in relation to advertising. You also raised a comment about safe and regulated and whether vape should be allowed on prescription. So at the moment, vapes are what they call a regulated product. So regulated vapes have to go through safety control measures. And on the Medicines Health Regulatory Agency, also known as the MHRA, have details about which products have gone through that process. At the moment, MRHA have put a call out to companies to say, are you interested in providing your e-cig under prescription? As far as I know, there have been no companies that have gone through that particular process yet. And the final comment that you made about the DARE programme, we are working very closely with Nottinghamshire County Council School Health Hub programme, and that the School Health Hub are doing great work in making sure that we get evidence-based interventions out into schools. So the Intent programme has a really strong evidence base behind it to help children and young people quit smoking. But also that whole school approach to vaping is the other thing that we're doing. But if colleagues are aware of shops that are selling to under 18s, I would encourage them to report that to our trading standards departments. And if people are concerned about advertising standards, the Advertising Standards Agency can also take up the advertising element of that. Thank you.
Thanks. Good luck with trying to stop it on TikTok. But Councillor Pringle.
Thanks, Chairman, and thanks, Kathy. I think you've got a very difficult operation to fulfil this. And before I start, I hope you have a good holiday when you do eventually get off to it. I have real difficulty with this and the fact that we're accepting 5% as the norm when we're accepting 95% better than cigarettes in general. I think you listed 240 components, of which 69 were carcinogenics on standard cigarettes, and one product from an e-cigarette which has been banned in the UK. There has to be more than that. I would assume that because of the manufacture of the e-cigarettes, that there's more than just one product that needs banning, in which case that puts us in a difficult position to see this moving forward in accepting a 5% uncharted area from a product which could actually cause death later on. So I think from a scrutiny point of view, Philip, I think we need to know exactly what's included within this 5% on a component status that is something which could cause health issues further down the line, because it's undoubtedly public health and ourselves that are going to need to respond to that with funding to take care of those people. And I get, the legislation which Councillor Guildford brought up, so we've got to be paramount. We walk into shops and we see a rainbow of effects, basically, that any kid can pick up, and whether the shop owner does or doesn't sell it to them, it's available to them, and it's an attractive. How is this happening? I think rather than doing a survey with our children, as Councillor Guilfoyle indicated, we need to be doing a survey with our MPs. So this legislation needs to stop. These need to put, if they're going to sell them, these needs to go behind the counter, same as standard cigarettes, and take them away from there. It was Chris Whitty that said there's no public evidence and regarding the health results for our children. Well, there might not be at the minute, but I think there will be, and I think it'll be negative, and I think we'll end up paying for it at some point. So again, that's legislation for those with the power to change things that we need to look at. But I've got a serious issue with regards to the recycling of the product. Once it's dropped, same as a fag butt's dropped, and the 10 years apparently that it takes for that to degrade. If we're dropping an e-cigarette or the tubes that give the flavour, then how long does that take to degrade? Because it's not a benefit if it's taking longer than 10 years. If it's taking 20 years, there's certainly no benefit to us in that. And as regards attracting kids, change the legislation to take it away from bubblegum flavours and strawberry and raspberry flavours and make it dog poo and cat poo and cow pat. I'm sure that would stop some of the kids taking it on board. But it's got to be driven from legislation. Because for me, I'm not comfortable in accepting that there is still although it's 95% better than smoking as we see it, there's still so many results that we are not aware of that I'm fit, and as you said, there's already been products banned in America. I'm fearful that we will end up paying further down the line. So for me, there has to be a legislative drive on putting these behind counters that are obvious to our children.
Did you want to come back on that, James?
If I may, yes, please. Thank you, Chair. It was to acknowledge some of the points you're making, Councillor, to briefly reiterate one or two things that Kath has touched on, to make sure that it is absolutely clear. So the value of vapes, where they have value, is as an alternative to smoking. We just want to reiterate again what Kath touched on before, where there's a choice between vaping and fresh air. Choose fresh air for the reasons you've said. We do not yet know what the long-term consequences of vaping is going to be. You're quite right as well to acknowledge the enormously important role that the regulatory framework and taxation has had over recent decades in terms of reducing tobacco, and I believe the important role that it could play now in protecting some of our children and young people from some of those possible consequences of vaping later. It is, however, important that in terms of retaining the trust of people in Nottinghamshire, that we continue to run with the evidence that we have at the moment. And the evidence that we are relying on is that's been nationally gathered. I do not wish in any way to discount the horror of the prospect that vaping might only be 5% as harmful as tobacco control. There is a horror in that itself, absolutely. Nevertheless, they do represent a really important tool to assist people who are currently smoking, half of whom will probably die of something related to their smoking, to get off tobacco. And so there is that balance to be sought as well. The other, if you were inquiring about my advice, in terms of writing to MPs and government and so on, I would not wish to restrict it just to vaping. If a letter was being written, my advice would be that it would be to urge the government to implement all of the recommendations in the recent Khan review in full, and not only those relating to vaping, although it did have some really important recommendations around that. Thank you.
Okay, Jonathan. Did you want to come back?
Yeah, please. Just for clarification, I'm not knocking what Kathy's done in any way at all. In fact, I praised that. I told you she'd been sold a pub when I started out, and I even wished her happy holidays. Nobody else has done that. However, what we are seeing is an increase in use within our children. That is the issue that concerns most of us on the station platform. That is the issue which has to be addressed immediately. No doubt that there's a benefit to someone that smoked for 40 years that are now vaping, happy days. Yeah, that's your choice. But when it's being sold as bubble gum and strawberry and it's flashing in the kids' faces, that's wrong on any stretch of the word. So the legislation has to change, irrespective of what you include it with, Jonathan. That has to change and it has to be driven. And if it's driven from us, I'll be happy.
Thank you for that. Councillor Dare.
Thank you, Chair. Vaping, of course, totally anti-vaping, totally anti-smoking. I've seen too many people die from both. And I lost two of my senior brothers to smoking when we were all told it was okay to smoke way back years ago. Now we've been told it's okay to vape. So in 20, 30 years we'll be told that killed us, that's poisoned us, and that's influenced where we are today. Now, we have to somehow, when I sit and watch children walking along the street, coming out of secondary schools, more than primary schools, vaping along the road, it just can't be right. When I watch adults now getting around the smoking regulations in pubs and restaurants because they sit there vaping with their families, sitting around them when they're out for a meal. They sit there, you can see them, you know, and have a vape. So there's something wrong with our regulations. There's something wrong with the way we're managing this, and it's going to come back and bite us. Now, I would have thought, I know, Jonathan, you go on the national issue where vaping is better than smoking. I don't accept that. I can't accept that. And I can't accept to think like that because we know that vaping ain't good. When you listen to children saying, oh, did you know there's a new taste? There's still the nicotine, but there's a new... It can't be right. It can't be right that a 12, 13, 14-year-old is where... I remember, as a child, I remember my neighbour giving me a butt of a cigarette at that age. It didn't do me any good. Fortunately, I was lucky enough to, when I grew up a bit further, they said, this is wrong, I'm not doing it, because I don't have a chimney in my head, so there's no reason for me to smoke. But we just got to somehow get an emphasis here. And I know Mike has said about where it all is, and I'm not going to repeat all of that. But it must be in the pricing. But the biggest thing is it's in the taste that the children are getting, and as you see them, and they're not locked away, they're just there. And I just find it totally that we can sit here and say, oh, well, it's better than smoking. To me, it is not better than smoking, because it might be better than smoking to somebody of 50, 60 years of age, but it's not better than smoking to somebody of 12, 13 and 14 years of age, because they're going to end up with a person of 50 years of age has got the problem who's smoking now. So we've just got to find an alternative approach, put pressure wherever it is. The Department of Health, they obviously think it's going to get the people off smoking and vaping, but it's not. It's going to take us down the same road. We're going to be in the same place in another 20 years with these young people of 12 to 13. When they're in their 30s, they'll be suffering or something because the nicotine's still in there. And the other thing, when you question it, we do not know, and a lot of these things are manufactured in China, we do not know what the other additives are of chemicals and stuff like that that could be also harmful because, well, I haven't seen or heard, but when you ask the question, you don't get any response as to what else could be in that product that can do health harm as well. So I feel really, really strongly about it, and I think as Nottinghamshire and Nottinghamshire Health, Jonathan, and you, we should have a lot more pressure in the areas of where we need to be to prevent a catastrophe in the next 10, 15, 20 years with our young people.
Thank you, Councillor there. I, like you, can remember cigarettes, and I did start smoking, unfortunately, at a very early age on the bus coming back from school. But I can remember cigarettes being promoted like, for your throat's sake, smoke Craven A. You're never alone with a strand. And then they brought out menthol cigarettes, Consulate, are good for your health and all this rubbish. And then they found out that actual menthol addition to cigarettes, if you smoke more than 20 Consulate a day, you actually ended up with menthol poisoning as well. So No, we really, and I think it is legislation, as everybody's been saying. It's about getting the government to legislate, because at the end of the day, the intention about vaping and taking people off cigarettes and putting them onto vape wasn't intended to be splashed all over the high street, multicoloured, advertising them with a view to getting young people to take them up. And I think that's something we need to stress with our members of parliament. And I think at the end of this meeting, we will be making a recommendation that we write from this committee to all the MPs in Nottinghamshire, asking them to take a look and promote legislation. If it means the whole of the Khan report, then I'd take your recommendation on that, Jonathan. But certainly we need to be forcing the legislation through, because it's rife, and I see it myself every day. Councillor Carr.
Yes, thank you. I think the issue, one of the big issues, is that the vape market is a huge competitive market at the moment. That, you know, there are shops springing up everywhere, and they're all in competition with one another. You can bet your wallet that the market will sort itself out eventually, but in the meantime, there will be that, if you like, tendency to actually sell to people you shouldn't be selling to keep you, to be able to pay you rent and keep your profits up. So until that's sorted out, it's going to be a huge problem. I'm glad that Councillor Guildford brought up the DARE project. Most schools in the early 2000s went through the DARE project, including my son, who was 8 in 2002. He's now 28, and he has never smoked a cigarette, has never touched drugs, does have the occasional alcoholic drink, but he lives in Canada. It's part of the course in Canada. But it really made a huge impact of children of that age. The reason that DARE was very, very widespread in schools in those days is that the school curriculum wasn't as tight as it is now. Try to get in DARE into schools nowadays is nigh impossible, because they just haven't got the time to deliver it, or the money for that matter. And that is experience at the Broxtowe Action Plan, which is a multi-organisation committee that look at stopping people committing crimes. And one of those ways is actually to stop them going into drugs and alcohol. But actually getting DARE into schools is very, very difficult. And it's proved that it works. And so it really, you know, I could say, and I've experienced this as being an exam invigilator, that a lot of schools spend most of their time teaching their children how to pass exams. Not necessarily the content, but how to pass an exam. That is not the most important thing for the development of a child. And we need to be looking at other things as well. It's out of our control, because most schools now, of course, are academies and don't come under the control of the local education authority as they used to do. But it's certainly something that the government and the Department of Education needs to be looking at very, very strongly. And perhaps we could put that in our letter as well.
Thank you, Councillor Carr. Councillor Smith.
Thank you, Chairman. I think you're in an uphill struggle with this, and I think everyone, nobody would disagree with that. Perhaps controversially, for this committee, with the views expressed, I do agree that if somebody is determined to smoke and they would like to smoke, I would rather see them vape than smoke. I think the issue then is when the vaping then creeps into, as everyone has said, into kind of youth advertising. Locally, just across the road from me, we've got a new co-op that's just set up, and it's got an enormous advertising board, and it's just filled with, it's just a picture of a vape. So yes, you wouldn't get that with fags anymore, or cigarettes anymore. I think it needs to go that way with vaping, and I suspect it will at some point. But if we can push that along, that'd be fantastic. I would think a letter to an MP would be something fantastic and well within the remit of this committee. Philip, I'm sure you would probably agree. So something I'd happily support with that. The only thing I did have a question on, this is slightly changing the route of it, but at the start of the presentation, it was mentioned there was 1,124 deaths from smoking. How do we actually kind of quantify that? Because obviously that's quite a broad area. So I'm just wondering how we quantify that. Final point: the resources for schools, I think, is a fantastic idea, and I wonder if that might be something that members could be given as well, and we could help promote it as well. Thank you, Chair.
Jonathan, do you want to come back?
I'm going to come back on the latter bit and invite Kath, Chair, if I may, to add a couple of comments. For sure, we'd be pleased to provide you the materials so that you can take a look at those, and that may indeed prompt other things that you wish to give some further focus to. And in terms of the challenge and support which has come from several councillors around the chamber, that's acknowledged absolutely. I think we are actually on the same page in this. There is an unknown impact and consequence of vaping that we need to be very aware of, and some of this, as you have noted, is out with the direct control of the council. There are some other things that we can attend to. Kath has given attention to some of the additional work we want to do locally to understand for ourselves what the motivators are for some of our young people to take up vaping, in addition to the colourful, very appealing advertising, to make sure that the messaging that we use doesn't just reflect what we think is important in terms of the evidence base, but actually what is going to be motivational for them as young people. Chair, I wonder if I might just pass to Kath to add comments.
Thank you for that. I've made a note of a couple of comments, so if I could sort of round those together, as many of you have said, that dual issue in relation to making sure that the regulation is tight in relation to advertising of these products, I'd very much applaud, and also thinking about taxation, making sure things are behind counters rather than in front of counters. The work that Nottinghamshire County Council School Health Hub do is really important for us in helping to get into schools, and so your support with the Intent programme would be very much appreciated. And I also picked up on the question in relation to flavours, and the colleague who made the comment in relation to flavours. You're quite right, we're different from other countries in that multiple flavours have been allowed that have been quite attractive to people in comparison to New Zealand, where they only allow tobacco flavoured vapes, which is a very different approach. So I think that's a valuable point. And one of the councillors earlier mentioned about litter, and you're right, certainly these single-use plastic products, they have the plastic on the outside, they have a coil on the inside, and they have a battery on the inside. So they're not recyclable products. And like you say, in relation to cigarette butts as well, and in the calculations that have happened in relation to those the 242 million that smoking costs us, littering is included within that. And then the final comment that I made a note of was in relation to the calculation of the death statistics that we have in relation to smoking. So certain conditions are identified as smoking related illnesses, and individuals will be identified as smokers, current or past smokers, in relation to the calculations that they utilise to give us as good a picture as possible in relation to deaths that have occurred due to smoking. Thank you.
Thank you for that. Councillor Henshaw.
Thank you, Chair, for bringing me in. Very interesting report, and I read it with great. I was very interested because at the end of the day, and it's quite clear from the report that, and I agree with Councillor Adair, issues in relation to vaping, there may well be a problem in the future, but we haven't got the evidence at the moment to determine. But it has been, not proven, but a lot of experts in public health, in particular in relation to the effects of tobacco smoking, say that vapes are not as dangerous as smoking tobacco. I'm not saying that they're not dangerous or they're not safe, but they're less dangerous than tobacco. The overall issue, as I see it, is let's write to the people that make the legislation so that we can try and encourage younger people not to start vaping. And for the older people that possibly have gone on to vaping switch from tobacco to vaping, well, switch from tobacco to vaping, but don't stay on vaping forever. Eventually wean yourself off of vaping. The work that is going to be undertaken with schools, I wholeheartedly agree with. Bearing in mind, you mentioned the statistics of people that are affected by smoking are in Mansfield, which is where my division is, and Ashfield. Can you explain to me how you're going to choose the schools that you're going to work with? Because it would be interesting to know whether or not there'd be any schools in my division that I regularly drive by and see children smoking vapes outside the school premises. So that would be something I'd like to get involved with. And Councillor Pringle's point, and I think it's very valid, in relation to how we recycle the discarded product, because they do contain a battery, a lithium battery, as I understand it. These batteries can be recycled if they're taken out of the actual plastic surround. And I know the government is working with the manufacturers and with people who sell them to actually come up with some form of recycling centre, drop-off point where you can put your used and discarded vape, because there's nothing worse than seeing them. We all see them, they're all thrown around all over the place on grounds, on playing fields, and I think it's something that we must really tackle in relation to, one, the lithium is a valuable resource that's only finite, so it needs to be recycled wherever possible. So therefore the manufacturers and the people that use them and the people that sell them, we all need to be in on this with our recycling and waste collection, waste disposal hat on. And I think we need to add a recommendation that we should be working with everybody concerned to make sure that there is some form of recycling for the vapes. Thanks, Chair.
May I respond to that, Chair?
Please.
Thank you. Sorry to the councillor who asked the question. I don't have your name, but if you want to email me, catherine.pritchard@notcc.ac.gov.uk, then please do so. So your first question was in relation to how schools are decided in relation to the intent programme. So we've asked the Schools Health Hub to focus initially on the areas with highest adult smoking prevalence. So indeed Mansfield and Ashfield have been areas that they've targeted, but we would welcome support in sort of getting into schools in relation to areas. So we've had 12 schools sign up so far, and I'm fairly certain a couple are in that area already, but we will reach out to members of the committee in relation to the intent programme. So thank you in relation to that. As regards recycling, you're right, these products are plastic products that have multiple elements to them, as you identified. They have heated coil elements in them as well as batteries. So we need to find a way to deal with those products and recycling of those products. And thank you. One of my colleagues has just mentioned it was Councillor Henshaw that asked that question. So we will reach out to you when I get back from leave. Thank you.
Thanks for that, Councillor Kerry.
I just want to say that I'm pretty much in the same space as Councillor Henshaw on this. This is a really, really tough subject because we're being asked here to consider the future of lots of people here, both young and old, both current smokers and non-smokers. And I think my experience, and similar to Councillor Guilford, my dad was 47 when I held his hand when he passed away, and it wasn't cancer that was shown on his death certificate, it was pneumonia, because the result of the cancerous lungs was fluid on the lungs. My mum passed away 20 odd years ago on oxygen for a similar reason. They smoked Park Drive non-tip cigarettes, 40 to 60 each a day, and I went to my local shop to get them, my corner shop as a kid. So I really understand how important this is. And a lot's been said, and I agree with almost everything. I hate vaping. I hate people that ignore things in pubs, on buses, or football grounds, or whatever. For me, the key thing here, I don't know about the medical science that's involved in this, but what I do know, if people really sincerely and utterly believe that it's safer to vape than it is to smoke tobacco, everyone that we stop smoking tobacco and make them smoke vapes will save whatever is it, 45% of those that smoke end up dying early. And I think that is the difference we're talking about here right now. As I say, I'd like to get everything, they all stopped and whatever, but I think that we've got to be very careful that the decision we make does have an impact on some of those people that are affected by this terrible habit.
Thank you, Councillor Kerry. Councillor Martin.
Yeah, thank you, Chair. I mean, you've all quite rightly recognised that legislation is the issue. It clearly is. Not only on the vaping and the parameters around it, but also on recycling as well, and how we educate children in schools. It's all about legislation. But we're in a step change, and we're caught between a rock and a hard place. As a county council, we have to get the message across that if you don't vape, don't start, and if you do smoke, step down onto vaping. And that's the only way we can. That's where we're trapped to. We're boxed into that parameter at the moment, and we know for full well that you know, everything that's happening is driving us to look at it, and that was the main reasoning for bringing this to the committee, to make us all look at it and to say, hang on a minute, something wrong here, you know. And you've all recognised that legislation is the issue, and it clearly is, and the officers are caught between the rock and the hard place there. What would be interesting, what I would be interested to know is we keep hearing that 3 people a day in Nottinghamshire die from smoking. So the step change down onto vaping and then off to vaping is the right path to go, and only legislation will change that in the future. But at what point, because this is the thing, at what point will we start to measure? How long will it be before we start to measure if that person died from vaping, and how will we know whether that person died from vaping? This is an area that's still in the future, I believe, and that's my question really going forward. How would we know whether their death was from vaping, and when will we ever get any statistics? Because we don't actually know from the current situation whether it was vaping or whether because it's such a low level. It's such a step change and a low level traceable thing. The only way we're going to find that out is through data over a period of time. And I think that's the thing that worries me looking into the future, because my kids are only 18 and 21, and neither of them vape or smoke, but plenty of their friends do, and it's always been the same kind of attitude. People took up smoking because it was a trendy thing to do. I mean, if you remember, I remember as a kid, all the film stars used to do adverts about smoking Park Drives and John Player Black and God knows what, and that's the thing. And now I've got a shop on my high street in Jacksdale. It's the trendiest shop going, and it's all about vapes. It's like the kiddie catcher shop. You know what I mean? It's like bringing people in. It's drawing them in, and I think New Zealand's policy is very good. Because if they're only using nicotine-based vapes that are recyclable, then that's probably the way that we should be driving vapes in this country. Because then you wouldn't be able to go in and have the almond flavour. Have you tried that? have you tried the strawberry rock flavour? You know, to me, whatever it is, because they're all bizarre flavours to me. But yeah, they are. But I think that's part of the way that we ought to be driving it towards narrowing it down to being able to buy nicotine only. Putting it back behind the counter is like putting a bottle of gin in the fridge in the cupboard and trying to hide it and say I don't drink gin. It'll work to a certain extent, but you'll always get that element that want to do it because it's a trendy thing to do, and it's a society change in the way that we do it, and it's not an overnight thing, but it would be greatly helped with legislation, and I think that's everybody in the room's recognised that. Thank you.
Thank you, Councillor Martin. Councillor Owen.
Yeah, thank you, Chairman. I think there is, going back to what I said before, there is work here in actual scrutiny to look at which methods are effective, if any of them are, in deterring smoking and vaping, and consider then recommendations to redirect resources within the county council to those areas. I was on the front line of this for over 30 years in my teaching career as a biology teacher and ultimately head of biology in Highestill. A lot of the time in Ashfield, so clearly I wasn't as successful as I would have liked to have been. But you can, the young people, they know what the dangers are and they still ignore them. When I set questions at GCSE on smoking, as I do from time to time, and the effects on pregnancy and what have you, I get some wonderful answers. They all know what the problems are, but that doesn't mean to say they're not going to carry on smoking. And I think, as members have said, to my mind, the real answer lies in legislation. The big step forward, in my view, as far as smoking was concerned, and I don't know which government it was, that banned smoking in public places, in pubs, restaurants, cinema, in indoor places, not public places. That to me was liberating, because you could go into a restaurant and not have to crowd into the non-smoking area only to get the smoke drifting over. And it was the same in the cinema as well, and on aeroplanes as well. Yeah, you was it? I can never remember now. Did the non-smokers have to sit at the back? But talking of aeroplanes, we have the absurd situation now, particularly after Brexit, where you can get duty-free, can't you? Duty-free cigarettes and bring them in. Now, why encourage smoking by giving a duty-free allowance? That could go quite simply. But to my mind, legislation's got to be much more robust. I would go further, and I know it'll never happen, but I would go further and ban smoking and vaping in public, full stop. I know there will be people who will disobey the rules. There always are, whatever the rules are. But I would ban it completely and send out a clear message. I wouldn't allow it to be sold open and above board, as we've heard. And I've got a shop in my division, which the children go from school and walk back through the shopping precinct, and there it is. What sort of message is that sending out, both to adults and to young people? And I just feel the tone of this report was almost pro-vaping. Now, I know from what people have said that perhaps wasn't the intention, but it was almost pro-vaping. So we need, in my view, some robust legislation, and I hope your letter to the MPs may encapsulate that. Why young people smoke and take up vaping? Because I suspect it's anti-authority. You know, they want to fly in the face of authority, and it seems cool to do that. And I would say to Councillor Henshaw, if you go past a school where you've got children standing outside smoking, then as soon as you get home, you want to be on to the head teacher ASAP and say, what on earth are you going to do about it? I know when I was in a senior position in an Ashfield school, I used to be wandering the streets prior to morning school, down the footpaths, down the jitties,
and I mean, I let them see me coming, and I didn't chase after them. And they that's that's the action of the school. That, I think, is an indicator of perhaps discipline within the school rather than anything else. But anyway, I think we're more or less at a consensus, Chairman, but we do need robust government action. And without it, we're pissing in the wind, I think, quite frankly, not to put too fine a point on it.
Very briefly, New Zealand's been mentioned twice, and I was in New Zealand 2 weeks ago, and the rate of smoking between 18 to 24 is hovering around 3%. You mentioned we need to get on the why people start to smoke. It's the same as it was 50 years ago when I did, but I only smoked for 8 years, and that's peer pressure. In New Zealand, because of the school system and how they're taught about these things, the peer pressure is the opposite. The peer pressure is not to smoke rather than to smoke. And it's getting from where we are now to getting to where countries like New Zealand, Australia and Canada are, that the government and authorities need to be looking at.
Councillor Kerry, then Councillor Guilfoyle.
Just a final question, and it relates to the comment just mentioned. I'm not sure if it depends what you mean by peer pressure and how you define it. I just wonder if a significant amount of tobacco smoking is to enable the smoking of Class C drugs such as cannabis.
Do we want to respond to that first before I get Councillor Guilfoyle's question?
It's not something I've come equipped to respond to with any kind of detailed evidence. I'd be pleased to do that on another occasion. I've noted the other comments that are being made. Thanks.
Councillor Guilfoyle.
Thank you, Chairman. I think we've had a brilliant discussion over this particular issue, and we can see how important it is. I think I'm just looking back to see the cost or the benefit it is to people who are selling it. It's it was a 1.34 billion pound industry, and that was in 2021. And that was a 25% increase on 2017 prices. It's a major industry now, and a lot of the tobacco people have gone into it and are funding it because they know it's a major industry, and that will be one of the difficulties that we face in our efforts, because they can throw a lot of money at attempting to divert people into it. But the important question for me, though, is that we do the cessation smoking and we encourage people to stop, but use certain means in certain circumstances. One of those is vaping. And I just wondered if within that we also are giving enough time to encourage people to then come off the vape. So I don't know how it works. Here we are, we sort of say, right, you've stopped smoking. Somebody says, yeah, fine, I'll go on to a vape. Yeah, I'm using a vape. That's easy. Do we then just let them go? Or is there then additional effort put in to actually say, you actually now need to come off that? Because I think that's key.
Yeah. Do you want to respond to that?
Well, I'm going to let Kath respond to that, because it's about actually how our current service is working.
Thank you. Yeah. So our service works on a 12-week model, and people are given a choice in relation to how they want to quit smoking. So nicotine replacement therapy, so people might be familiar with these in relation to patches and gums, etc. So people may want to quit using that, or they may want to quit using an e-cigarette. So our service will work with people, but you're quite right in relation to people who quit using an e-cigarette. They'll probably use an e-cigarette for longer, because that gives them that sustained nicotine hit that is so addictive to people. So people will probably vape for longer than utilising NRT. But for those people who are particularly addicted to nicotine. So many of you have shared experience of losing family members through tobacco and their nicotine addiction. You will know how strong that addiction is. So the evidence that we've got at the moment is that people will continue to vape longer than people who use NRT to quit, but they're also the most heavily addicted to nicotine. Thanks.
Thank you. Perhaps we should insist they make them all taste of cabbage. The children won't want to take them, will they? No, that's rather a flippant remark, but I think it all boils down to the taste and the flavours that they're putting out, and they're deliberately doing it to encourage children and young people. And I think it's marketing, and it's wrong. It's legislation that we need to control it. Thank you very much, everyone. We've had a nice and long, thorough discussion on the issue, and I think the main point that's coming out of it is that we craft a letter from this committee to all the MPs in Nottinghamshire, expressing our concern about the vaping amongst young people and looking at control of advertising. I've not read the Khan report, so I don't know what it consists of. I know it's about smoking as a whole, as well as e-cigarette. How much it goes into the legislation and banning of advertising of e-cigarettes in that report, I'm not that sure about your knowledge on that.
So coming back to our overall duty as a council to improve the health of the population and to reduce inequalities, and to do that we need to be thinking about the whole tobacco control agenda, and that's what the Khan review is about, vaping being just one part of it.
And does that specifically talk about controlling advertising and promotion of vaping or not? Because if it doesn't, and I don't propose to read the whole of the Khan report because I think it's quite a few pages long, then we need to specify that in our letter as a separate issue.
So I can provide you a summary of that. From recollection, there are kind of 15 key recommendations, and outside of this, I can provide you a summary of that. And if you feel that it's not covering the points that you want to make, then of course they can be made in addition.
Yep, so if we could all have a précis of it, because I looked at it and I thought, no, I'm not going to read that. That's it's going to take me several hours out of my day, and at the end of it, I probably wouldn't understand half of it anyway. But so the main recommendation coming out of this afternoon is that we write in strong terms to all the members of Parliament in Nottinghamshire, and also to the Environment Agency about recycling. Although it's not remit of this committee, but I don't think it'll do any harm for us to mention that. And then I think we made a couple of other notes, Martin, as well, if you want to just go through.
Yeah, again, and they're in a bit of they're not in any particular order, because they were taken down as we went through. Firstly, that the Cabinet Member for Adult Social Care and Public Health, in consultation with officers, gives further consideration on how the messaging and information on the relative reduced harm of e-cigarettes to cigarettes is carried out by the Council. That the Chairman of the Adult Social Care and Public Health Committee writes to all Nottinghamshire MPs and the relevant Secretary of State around the committee's concerns around the advertising of use of e-cigarettes and vapes, and also around the Khan report, but we'll get that word slightly better for the minutes. The information be circulated to members of the committee on the reduced health impact of e-cigarettes to tobacco. That information and analysis gathered from the health related behaviour survey that's due to be carried out later this year be shared with members of the committee to enable them to use it to highlight areas that require more detailed scrutiny and analysis. That members of the Adult Social Care and Public Health Select Committee receive the information that is provided to school to help them address the issue of vaping. This is kind of connected to one. That work be carried out with members to establish how elected members can work with officers to support the delivery of the work with schools around vaping and smoking. The Chairman of the Adult Social Care and Public Health Committee writes to the Secretary of State for Environment regarding the committee's concerns around the disposable vapes and their recycling. That the Chairman and Vice Chairman of the committee, in consultation with officers, consider the most appropriate methods for the committee to carry out further work on vaping and tobacco control. And that finally, but we'll slot this one in earlier, that the summary of the current report is circulated to members of committee. Sorry, that's an awful lot.
It's an awful lot.
Can I make a quick suggestion that instead of, because public health and health services are very often cross-boundary, that we include the 3 city MPs in that letter as well?
We can do, yeah. I don't see any reason why not. I mean, to me, Nottingham is part of Nottinghamshire, but there you go. I go back to the days when it was. Are we content with all those recommendations? All in favour? It's clearly carried then, thank you. On the agenda is the work programme, and it's really a quick introduction by Martin and then any comments or suggestions for the work programme.
Fantastic. So the work programme, just as an area, just note about the work programme. Obviously, the work programme is reviewed every year. So once we get like later on into the summer, before like the intermission for the holidays, we will do like a full piece of work on the work programme to actually look at what you want to look at next year. So that's more or less starting from scratch, looking at what we've done, looking at what can be carried forward. So that is a piece of work. There's a couple of small projects that we'll be wanting your approval for. We've been approached by officers about the recommissioning of the integrated sexual health service, so we're trying to get a meeting set up about that. So we're just seeking your approval to do that piece of work, and then we'll be sending out information on that to committee members. And then also and that's a joint one with because obviously it's that can be with the children and families select committee members as well. And again, another joint piece of work that will be again with children and families is about the recommissioning of the Healthy Families Programme. Obviously, that report went to Cabinet last week, and part of the pre-decision work that we took on that report was that further like ongoing scrutiny work carries on alongside that. So again, looking for your approval to do that as a piece of work as well. And obviously the work programme's on there for your consideration. And just my normal reminder, just keep your eye on the forward plan. If there's anything that you would like to look at, just let us know.
Thank you. Has anybody got any further suggestions or work that they wish to?
Start at 7.
If you flipped over the page, there are items pending scheduling or removal. Yeah, so it's only actually 3, so you needn't have apoplexy yet. Thank you everyone for your attendance, and it has been quite a long meeting, and thank you officers that have been patient and stayed around for the full meeting, and safe journey home everyone.